Can a tibial stress fracture heal without surgery? I'm Dr. David, orthopedic surgeon and sports medicine specialist. I provide education, information, and commentary on all sorts of sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Tibial stress fractures are very, very difficult problems for running athletes. You may just like to run for exercise. You may be in track or cross country if you're, a high school or college athlete, and they're really tricky. Some go on to heal on their own, but there's a small group of them that no matter what you do, basically, stop running for a while, even being on crutches for weeks may make them go on to not heal. In today's Ask Dr. Geier video, we talk about one of the more challenging tibial stress fractures and is it possible to heal without surgery? Keith Edwards writes, "Hello, due to running, I developed the dreaded black line in the middle of my right anterior tibia. After stopping running, all the pain disappeared within a week or two. Now 5 weeks later, I can fast walk with zero pain. The bump on my shin is greatly reduced to half the size of a dime. Yet I read the stories and I wonder if I have any hope of recovering and running without surgery. In your experience, have you seen people recover from the dreaded black line?" So before I answer that, let's talk about what that is. So the tibia is the long shin bone. And in the stress fractures that have been, basically there for a long time and they're not healing, on an x-ray what you'll see is a sort of a lytic, a black line where the fracture is, and it just basically has gone on to not heal. It's typically in the very front of the bone, and it's a very worrisome sign. Usually, again, that's a sign that it's not healing, and so very often we give up the, hey, you can't run anymore, or you're on crutches now, we're past that. And in my experience, that's where you at least think about doing a surgery. You put a rod down the center of the bone, maybe bone graft in the stress fracture site to get it to heal. Now, if it heals without that, terrific. I'm all for it. Just symptoms being better probably isn't enough to know that it's healed. So you would want to get x-rays or even an MRI and actually see that bone completely solid. But I'm all for anything that avoids surgery. My experience has been once it gets to that point, you're usually talking surgery. Now again, this is only a small percentage of people with tibial stress fractures, but pain in the leg, in a running athlete that's not getting better, you don't want it to get to that point. So that's where I think it's always a good idea. Get it checked out, get x-rays or even an MRI potentially to find out if you have a stress fracture, and do what you need to do to get it to heal very quickly before it goes on to become a chronic problem and one that is very hard to get back to running. Have you suffered a tibial stress fracture, and how did you get over it? Was it just rest? Was it a cast or a boot and non-weight bearing? Or did you have surgery for it? I'd love to hear your experience with it. So below this video, tell us about your injury and how you treated it and what kind of trouble it gives you. Not just because I'd love to read it, but I know people dealing with this who are watching all over the world would love to hear your experience as well. If you know somebody dealing with a tibial stress fracture, or maybe one of their kids has a tibial stress fracture, please share this video with them. I really hope it helps anybody dealing with this problem, so please share this video. If you like videos like this and you want more information on sports and exercise, injuries, injury treatments, and injury prevention, I record a couple of these videos every single week. So subscribe to my YouTube channel. Click the button in the upper right corner of the YouTube page. You'll get these videos delivered directly to you. And again, I really hope that it helps you. Thank you so much for watching. I hope if you have a tibial stress fracture, I hope this gives you the information you need, and I look forward to seeing you right here next time.